Now we'll actually look at another type of medical history taking. So this is a perinatal medical history taking. So when you say perinatal, when you say peri is around, okay, natal is that time of pregnancy, delivery, and all of that. Yeah. So perinatal history, you're actually trying to ask around everything that happened before a child was born. Okay. So the perinatal history taking, you just involve, you are trying to gather detailed information of everything that happened when the mother was pregnant, when she was in labor, when she was delivering, after the baby was born, what are the immediate things that happened. So it's very important, you understand, because this can actually form basis to why a baby is suffering from some disease conditions later on in life. So it helps you to identify all those neonatal complications and all of that. So for maternal history, you look at the demographics. So know the age of the mother, how many times she has been pregnant, how many times she has delivered, if she has ever had an abortion before. Do you understand? Then medical conditions, you see if the mother has any underlying disease condition that is of threat to the baby, like diabetes, hypertension, thyroid disorders, infections like HIV, syphilis, hepatitis. They also look at the drugs she took when she was pregnant. So drugs or any substance. Does she smoke? Does she take alcohol? All those things. Antenatal care, you look at how many times she came for the visit. Okay, look at the timing of the first visit, the supplement she took during the time. Immunization, that's where you look at all those tetanus immunization, COVID-19, rubella, and the rest of them. Then screening status. That's you look at our blood group, rhesus status, and the rest of them. So what next? Pregnancy history. You look at gestational age. At what age did she actually deliver? Then how is the baby moving? Was it normal or reduced? Multiple gestations. Okay. Then you look at if there was any test that was done for this pregnancy. Okay. You look at if there was any test done for the pregnancy when she was pregnant, of course. So moving to the next, labor and delivery. You look at when she started labor. Was it spontaneous, or did they have to help her with some drugs and all of that? Then did she deliver through the vagina? Was she assisted or was she not assisted? They look at all the complications that came up when she was delivering: shoulder dystocia, fetal distress, umbilical cord prolapse, the rest of them. Then you look at ruptured membranes. Okay. Then you look at was she actually aided with all those analgesias or anesthesias during childbirth and all of that. So immediate neonatal history. You look at the weight and Apgar scores of the baby at 1 and 5 minutes. You look at all the resuscitation that were actually done, the initial feeding, temperature regulation. Then were there any complications coming up early on? Then family and social history. You look at if their family has any disease condition that has been moving from generation to generation. Okay, and risks of autosomal recessive disorders. So for around the perinatal history, these are the important things that I shouldn't miss out and should always ask them.